When it comes to vaccine equity, politics is useful in bringing an issue to the forefront and in generating necessary resources. The decision-making is strengthened when data is used to guide those decisions, such as the distribution of vaccines. We can look at the diverse response to COVID across different countries as an example, from who gets vaccines first to what type of vaccines are purchased. It's undeniable that politics informs these decisions, but with availability of robust data, COVID response becomes more effective. My name is Nelima Otipa, and I'm the Data and Project Manager at Nexleaf and Analytics. And we advocate for the use of data in vaccine distribution planning every day. We partner with countries to ensure they have the data they need to effectively and equitably deliver vaccines. We design and deploy simple sensors that connect vaccine refrigerators to user-friendly data dashboards. So we're like the check engine light for a vaccine fridge, so that health workers can know when fridges malfunction and they can allocate resources to fix them. They also identify the strongest fridges, which helps to plan for vaccine distribution and equipment procurement. So our goal is to ensure data is at the core of effective and equitable vaccine distribution planning and long-term systems strengthening. So apart from the conventional challenges faced in vaccine access, such as insufficient funds to procure vaccines and vaccine hesitancy, the supply crunch problem has been of great concern, bringing to the forefront the clear imbalance that has seen under-resourced countries unable to access life-saving COVID vaccines. While most of the rollout challenges have been universal, the supply crunch issue has especially been evident in Africa. This can be seen in the fact that less than 2% of the 4 billion doses of COVID vaccines given globally have been administered in Africa. That's 2%, while which pales in comparison to the 53%, for instance, administered in America. So as such, public health experts and leaders have been calling for the fair and equitable availability of the COVID vaccine across the world, calling for it to be made a global common good, because no one is secure until everybody is secure. So as a result of the vaccine inequity, Africa has faced unique challenges, including use of different vaccines and the need to decide who gets the vaccine and who doesn't. For example, Kenya, Botswana, Rwanda, and several other African countries are rolling out more than 3 different types of COVID vaccine. This has created a number of challenges, such as differing logistics, different storage requirements, and training vaccinators to give different vaccines. Likewise, each country faces unique challenges in distributing and ensuring there's access to the few vaccine doses available. With just a few doses available, logistical precision becomes very, very important in ensuring the vaccine gets to the people who need it the most. So you need to figure out, will there be a particular focus on rural or urban or semi-urban areas to make sure there's access? Will there be places where vaccines will need to be given on, say, weekends or evenings to accommodate those working? Will you need outreaches for some areas? How will you accommodate people with mobility challenges? So these and many more are the issues to be figured out. So it then becomes important to base every decision on a particular country's lived experience and objective truth, which should essentially be backed by data. So while it's commendable that donors and governments are making heavy infrastructure investments to fill existing gaps and to get more vaccines into Africa, that alone will not lead to vaccine equity. Money and vaccines and donated equipment are crucial. But if they're not distributed wisely in an informed and sustainable way, they eventually don't actually deliver the positive health impacts that they promise. As such, the infrastructure and distribution chains built during the pandemic should not happen in a vacuum. Together with the infrastructure, sustainable systems that fit into the existing supply chain systems and led by the countries should be the priority. All this while using data for decision-making. Data can inform decisions, including helping identify underserved populations, assessing the strength of a cold chain, and ensuring big picture goals for a health system are achieved. So access to reliable, actionable, and high quality data ends up aligning perspective across stakeholders so that everyone is working towards a shared goal. So data is really at the core of vaccine equity. It provides a common source of ground truth. Data and politics can and should work hand in hand. But in the absence of data, vaccine equity is not possible. So I'll conclude by saying we should equip countries with the data and resources that they need, as data is the only way we can objectively achieve vaccine equity. Thank you.